Hi, I'm Dr. Polly Watson with Hormone Wellness, MD. Today I'd like to talk about problems with your period and how functional medicine approaches this differently, both from the experience of the patient receiving care and also the patient's responsibility in participating in their care. So many women have such severe symptoms, both with premenstrual syndrome, feeling bloated, having mood problems, maybe even constipation, breast tenderness, and then after their period or during their period, they may have such severe cramping that they can't go to work. Some women are experiencing symptoms from their period half the month, and this can be really debilitating and cause loss of time from school and work, as well as just greatly diminish the quality of life. When I went through medical school and OBGYN residency, we really weren't taught to start asking why the symptoms are so bad. We predominantly were taught to treat the symptoms usually with birth control pills, which sort of turn off the ovaries, turning off a regular cycle, and typically giving most people a fairly short, reliable period with less symptoms. And that approach can be effective for some people. Other patients really have a hard time with the side effects of birth control pills. But as I've matured through my career and I've learned more about integrative and functional medicine, I've also met a lot of patients that want an answer rather than a Band-Aid. And the way functional medicine looks at period problems like severe cramping or polycystic ovarian syndrome or PMS is to start thinking about the period as a vital sign. So if the period is out of balance, this is an opportunity for us to ask more questions and start getting to the root source of the problem. And many women are interested in getting answers to those questions rather than just covering up the problem. So from a functional perspective, we might look at the stress axis or the adrenal axis and how that breaks down and affects hormone production. It also affects our ability to clear hormones from our gut as our gut villi get shrunk when we're under a whole lot of stress. We may look at detoxification and the presence of toxins in the system. So there are lots of different things we can look at in functional medicine to start getting answers to why the system is out of balance. The patient's experience in a functional medicine partnership is also so dramatically different. So typically in a Western medicine setting, the patient is coming to the physician. There's typically a fairly short appointment time, maybe 10, 15, 20 minutes. They usually leave with a prescription and they may not be seen again for another year. The channel of information between the healthcare provider or doctor and the patient is usually kind of a one-way transmission. And in functional medicine, there's more of a partnership. So the healthcare provider or doctor might know a whole lot about systems biology and may know a whole lot about hormones, but the patient knows a whole lot about their life experience and their story and what they've tried before and what's worked for them before. And they know that critical thing that happened that they haven't felt well since. And so in a functional medicine setting, the patient and the healthcare provider or doctor are working together as partners. Instead of a passive role in leaving with a prescription, the patient leaves that encounter with a lot of education and also a lot of responsibility. So the patient is then hopefully supported and educated to start making healthier choices every single day, having to do with supporting their stress management practices, supporting their nutritional health, supporting elimination, supporting detoxification. So that can be a pretty big job. So for patients that are looking for a quick fix and they just want to take a pill, this may not be for you. Functional medicine is really well suited for people who are looking for answers, who are interested in asking more questions and are willing to start making changes with some support to start finding a new sense of vitality they maybe didn't know was possible. If this novel approach sounds like something you might be interested in, please make a discovery phone call appointment. We look forward to hearing from you.